Hello, YouTube. Give me one quick sec, you guys. Let's see here. The sun will come out tomorrow. Bet your bottom dollar that tomorrow there'll be sun. God knows we all need sun. Hello, YouTube. Nice to see you. I'm just starting the Facebook stream. Give me a momento. Just thinking about tomorrow. We must clear away the heartache and the sorrow. Let's see. Till there's none. Let's see here. Right, what did I say for you guys? Hello, Donna. Nice to see you, hon. I went one step too quickly with starting up the YouTube stream. And, you know, like, gosh, that is so weird. Is that better? All right, that's better for you. I'm on two separate computers. All right. All right. See, this is it's not staying. Stay. There we go. All righty. Yeah, I like to sing. I once sang in a choir. I sung in a couple of choirs, actually. I always like it. I like Celtic songs. Ooh, nice. Snowing, huh? It is partly cloudy here. All right. So here, let me. Hello, Facebook. Nice to see you. Okay, the Facebook screen is perfect. The YouTube screen is looking downwards because my camera is being weird. Stay. I don't know what it's doing here. I feel like I have to sit back for that. Oh, you gotta love the snow. I mean, the snow is great in small quantities. All right, guys. Hello, hello, hello. Jill Osborne from the Interstitial Cystitis Network. It is Sunday, January 16th. Wow, has the day gone? I mean, the month. Everything is so fast right now. It's crazy. This is our regularly scheduled support group meeting, although we did one on Friday here on Facebook too. And my purpose in doing these meetings is just make you so strong, so knowledgeable, so informed that no one can mess with you again. I don't want anybody minimizing you, demeaning you, telling you that this is all in your head, because it's not in your head. I know. Well, we got 4 on YouTube right now. That's okay. It's a Sunday. It's a Sunday. Normally, so my name is Jill Osborne. I'm the president and founder of the Interstitial Cystitis Network. I am the national IC support group leader and I'm close to the longest serving IC support group leader in the world, actually. I think I might even be now. I might even be. Isn't that weird? When I was growing up, I never thought I'd be spending my days talking about the bladder, but you know what? There's a need. Happy to fill a need. Normally when I do these meetings, I do like a 30-minute little educational intro. Okay, so Facebook is having some breaking up issues. Now, Facebook, you guys are on my streaming software, and it worked great. Everything is set up exactly the way it was on Friday. So, hi, Lisa. Hi, Caroline. Hi, Sharon. Hi, Betsa. Betsa says, can you take D-Manus along with a probiotic and herbs to help your bladder? No, I mean, yes, you can take it, but the question is what is D-mannose doing? All D-mannose is going to do is make it a little bit harder for E. coli to infect your bladder wall if you have an E. coli infection. If you don't have an E. coli infection, there's absolutely no reason to be taking D-mannose. Save your money. Save your money. So I was kind of thinking, actually, you know what? I just heard somebody, you guys, I'm caring for elderly parents. Give me a quick moment. I thought I just heard something. Hold on. Alrighty then. All is well. All is well. Um, so it's a new year. And yes, we're all living in quite odd and unusual and somewhat perilous times. It's kind of crazy. We have fires, we have floods, we have tsunamis. We had a tsunami hit California here yesterday because of the big volcanic explosion over in Tonga. And, ultimately in the end, life is perilous. Nobody ever promised us when we were born that we were going to have a pain-free life, or that we would have an illness-free life, or an injury-free life, or that we would have to deal with stuff. And kind of there's this old quote, it's not what happens to you, it's how you cope with it that really matters. And I think for the IC patient, especially in the new year, we have to, we have to kind of take a step back and ask ourselves, what did we do well last year? What did we not do well last year? So as an example, what I did not do well last year is I didn't take time to relax. I didn't take time to calm myself. I was always working and always stressed.
Out of the shower.
Okay. Okay. Sounds good. So, and even as I was going to bed last night, my heart was racing a little bit. And it's really hard to relax right now, right? I mean, like it's really, really hard. It just feels like we're just being bombarded. And so, one of the things that I need to do this year, that I must do this year, is I have got to take a step back, find some quiet time every day, and just be. And normally, if it were a sunny day, it would be working out in my garage, out in my garden, or at least sitting out in the sun. And I miss that, and I want that again. We can't just keep running, 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 running. You know what? You know what they say is you can't help somebody else if you don't help yourself first. We have to be strong, and IC is challenges you. It challenges you in a lot of different ways. It challenges you about your food. Are you eating well? Are you not eating well? It's a bit of a reckoning for patients who have a terrible, terrible diet. Oh yeah, Donna says tomorrow's Martin Luther King holiday. He turned 93 yesterday. What the world would be, Donna, if we still had that lovely, lovely man. Um, um, so we do have a little break tomorrow. That's good. Okay. Even more important these days. Okay, I don't want to be on a tangent here. The other thing that I am not particularly good at is I'm not particularly consistent about listening to my body and working with muscles. So as an example, yesterday, which was a day, Saturday is my only real good day off, where I'm supposed to be off all day. And yet I worked all day. I cleaned all day. I was doing things. And as the day was going on, my muscles were just getting tighter and tighter and tighter and tighter, till finally my pelvic floor was just throbbing. And so after dinner, I just went to my living room and I rolled around on my tennis ball and did all the stretches I need to try to get the kinks out. We got to get the kinks worked out here. And I think that we all can power through pain to a certain extent, and that's really not ideal. I think whenever we're in pain, that's our body saying, hey, stop for a moment. Let's take a step back. Let's see what we can do to try to address this underlying problem. And what's the secret to managing IC pain is to catch it early, to not let it get out of control. And that's also very, very true for, any other pain conditions that you're having, or just stress in general, or if you walk the wrong way and hurt your leg or whatever. We just have to be proactive early. No shame, no blame. If you need to sit on your living room floor before dinner or after dinner just to roll your pelvic floor muscles out with a tennis ball, you've got to do it. You got to listen. We have to listen to our bodies more. And that's just something that I really struggle with, is that I don't take the time to stop and do it. And then I just keep hurting myself over and over and over again. And that's just not the smart thing to do. In terms of resolutions, I haven't really picked a resolution this year. And I should have. I've had some really, really good resolutions. One year I vowed not to buy any clothes except for underwear, which I did. And I only bought like 6 pairs of underwear. One year I went without any cookies or cakes or pastries. One year I didn't do, what did I not do? I tried to work out every day, which I came pretty close to doing. So I'd really love to hear your resolutions. Do you have any interesting resolutions that you're doing for IC? I want to stop eating pastries. I have gained a wee bit of weight, and I tend to eat sugar after dinner, and I'm really working on stopping that now, and I'm already feeling some of that weight drop off. So my goal is I want to lose 10 pounds in the next 3 to 4 months. That's my only goal, and I just want to take it one day at a time, be gentle to me, be gentle to the people around me. So anyway, hi, Sandy. Nice to see you. Hi, Sylvianne. I'm not sure if I already said hi to you, Sylvianne. Sharon, I hope the quality of the videos helped. Caroline says it's really hard to relax for sure. Yeah. Sylvianne says, I'm very food sensitive, so my diet is really lacking in foods I can have, so I don't always feel well from eating badly. Well, I think the other thing, too, is for those of us who have pelvic floor issues, really, in many cases, they're kind of wear and tear injuries that have happened over time. And so we're really forced to deal with the fact that maybe we're sitting too long. Maybe we're not getting up and down. Maybe we're doing what a lovely gentleman that I was working with a while ago, who was sitting on his bicycle at home in front of his computer for hours and ended up with a pelvic floor injury. Shelley says, I'm newly diagnosed with IC and I have existing back, neck, and hip pain. Can I use essential oils for pain? Sure. In fact, I just got... So the first essential oil that we really, really endorsed came to us through the Endometriosis Association, called Pro Serona or NeuroQuell. And it's the essential oil of the marigold plant that has been found to be quite successful at reducing pain and discomfort. And Roger, the CEO of that company, just sent me some more. So marigold oil is remarkably good when you put it on skin at reducing, or I think what he said it did is that it temporarily kind of separates the pain nerves or disrupts that pain nerve from sending pain messages up to the spinal cord. Of course, you don't put it on your crotch. You don't put it on your inner bits. You would put it where you have pain, like on your lower belly. And so this is an example of NeuroQuell. It's a small little container, right? But man, it packs a really, really powerful punch. You just use a little tiny drop. The challenge with this, as he said, is that during COVID, the price has gone up 60%. Not 60%, 600% in shipping alone, because they have to ship it to multiple countries to get it processed correctly. And so, this little tiny container can cost, $45. But again, if you don't have access to pain meds and you're really desperately trying to reduce some of that pain, it's worth a shot. Of course, you can also do CBD. You can do a CBD from medical marijuana, a CBD cream. We even have some CBD creams in the IC Network store. Do I even have them up here in my, do I? I don't think I have them here, but I've got CBD cream over in the IC Network store along with NeuroQuell. And he just sent me this NeuroQuell Plus. And they're getting really good reviews with this. Let's open it up. I have to tell you, these have a strong floral scent. That'll clean your nostrils out. I don't know if you can see that. It's just a white, it's a white cream. Woo! Woo! Betty, that is strong. So it's just like really strong marigolds. And marigold just happens to not be my favorite flower. It's not like carnation. I love carnation. So essential oils is viable. I really like Tiger Balm myself. I use a lot of Tiger Balm. I rub it all over my hips and glutes, both sides. The other thing, Shelley, listen, since you you're newly diagnosed with IC, but you also have back, neck, and hip pain, then you really have to be aware of the musculoskeletal influences of the bladder. You know, not everybody has a bladder disease. You have to understand that for many patients, there's something outside of their bladder that's triggering their symptoms. And so given the fact that you already have a pre-existing hip problem, that really forces us to consider how that hip pain could be influencing your bladder, because it could easily be influencing your bladder and or your pelvic floor muscles. And so I'm hoping as you are in the process of being diagnosed that somebody did a pelvic floor assessment. So like for me, I have a bad SI joint that honestly, I just think keeps getting worse and worse because my muscles over on that side continue to stay very, very tight because they're compensating for this very, very loose joint. And, you know, it's annoying as heck, but at least I know that my bladder is healthy, that in fact, it is super tight pelvic floor muscles that are triggering a lot of the bladder symptoms, frequency, urgency, pressure, pain. So I would really want to know, what is your hip issue? That's important. There was a research study done with men with chronic prostatitis that found that a significant percentage of them actually had an underlying hip abnormality that required referral to an orthopedic surgeon. So we're really, really, really now looking beyond the bladder at muscles and bones. Hello, John. It's so nice to see you. Caroline says, my hip pain is getting worse. You're not helping anything. Exactly. Shelley said, just had a hysterectomy due to endometriosis in September. Oh, how are you doing, girl? You're only 4 months into your post-op recovery with hysterectomy. And I know for me, I started feeling normal at about 6 months. I mean, you know, partially normal at 6 months, but I didn't really feel myself until about 1 year, about 12 months after. Did you have any muscle issues, muscle complications? I sure did. I had a lot of pelvic floor spasms after my hysterectomy. Caroline says you've got osteoporosis and plantar fasciitis, you name it. Now, Caroline, remember that if you're not walking correctly, if you're limping, if you've got one leg longer than the other, that absolutely is going to be influencing your pelvic floor and potentially creating long-term pelvic floor tension and dysfunction. So what are you doing about your feet? Carla says CBD helps with back pain. Yeah, you bet it. Nancy said she had 2 major surgeries last year. She wants to work on getting better shape this year. Yeah, exactly. Exactly. Donna, do your thing, girl. Looks like we have somebody who does not belong in the room. I have on YouTube, you guys, I've got you on a 60-second delay. So you can only post every 60 seconds. Which gives us plenty of time to block somebody who comes in and tries to, you know, be a little funky. please, for this person who has come into YouTube, this is a legitimate support group meeting for people who are suffering. These are people who are suffering. They're in pain and discomfort. They're fighting for their life. This is not a place for you to come in and joke around. These people need help. And for you to come in and minimize what they're going through is like, kicking a puppy. It's disgraceful. And it shows your character, and it's just not a good thing to do. If you've got a family member in pain, are you going to go laugh at them, or are you going to sit by their side and hold their hand? That's what we're doing here. So move on. Just move on. You don't need to be here. Shelly says, yes, your pelvic floor is very tight. You started physical therapy last week. Shelly, how's the physical therapy going? Suzanne ordered the Tiger Balm. I've gotten to the point where I really love the smell of Tiger Balm. It's like spicy Vicks Vapor Rub. It's kind of like warm, where Vicks Vapor Rub is kind of cold. Tiger Balm's warm. It has a kind of a warm scent, and I absolutely love it. So Shelly has arthritis, bone spurs in your hip, tight groin pain, doing good with the surgery. Yes, many spasms and urethral pain. Yeah, so after my hysterectomy, I really had issues sitting down hard. You know how you act like you're getting into your car, and you just throw yourself in the car and you land right on basically right where you had your surgery. That created a very strong pulling sensation and was very, very uncomfortable. Anne says, is pyridium and Urabel similar? No. Pyridium acts to numb the bladder wall. Urabel acts to reduce some of the symptoms, and I think it's an antispasmodic. Caroline says they won't do anything about it. Have you worked yet with a podiatrist on your feet? Now that we understand just how badly foot issues can trigger a cascade of issues going up your leg into your pelvis, we're really taking also a much more serious look at our feet, and are we walking correctly? You got to really up your game with your shoes, huh? No high heels. You can't wear any high heels at all. You've got to have a shoe that helps you walk correctly. And yes, I know I'm older. Yes, I wore a lot of high heels when I was younger. I can't do it anymore. My feet hurt too much. I strongly recommend Hoka shoes. Let me tell you, that's a little dirty. These are the shoes that I wear all day, every day, Hokas. I'm a gym rat, even though I'm not going to the gym with COVID. So I usually always just wear sporty things anyway. But the cool thing about Hoka shoes is that they have 3 different cushions. So for me, I need a lot of cushioning because I don't have a lot of fat on my feet, because I basically destroyed it going up and down stairs for 10 years. I used to do 100 flights of stairs a day at the gym every day for 10 years, having no clue I was destroying the fat pads on my feet. So I love Hoka. So at least try to invest in some really good shoes like this, worth every penny. And if you go to Zappos, they're even on sale. I've got like 8 pairs of them. Caroline says, you have another UTI, you're so fed up. Well, okay, so if you're struggling with recurring UTI, the first question we need to know is it the same bacteria, or is it different bacteria every time? If you can go back and ask in your medical records to, guys, you never, ever have a doctor say you have bladder infection without asking for more information. You need to know what the infectious agent is. Is it E. coli? Is it staph? Is it strep? Is it enterococcus? Is it micrococcus? Is it Klebsiella, right? It's very important that you start tracking your infections, because If it's the same infection every single time, what that means is that you either have a super resistant infection, which is very common with E. coli, or you have something in your daily life that is inoculating you with it, like a bathtub. If you have jets in your bathtub, if those jets are not installed correctly, they can become reservoirs. The water stays in them and they just really start growing bacteria and they just live in there. And the Center for Disease Control has actually done quite a bit of research on infections that occur in swimming pools. And I'm just going to tell you right now that I would never swim in a public swimming pool. And most importantly, I would never get into a hotel hot tub. Never, 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 never. Number one, there's just a tremendous exposure to a lot of different bacteria, but we have to make sure that it's maintained correctly. If it's not maintained correctly, then you're literally sitting down into a lovely little bacteria stew, for lack of a better term. Now, here's the other thing. If it's a different bacteria every time, then that really speaks to your immune system to a certain degree. And we would then want to know what's going on with your immune system that's making you so vulnerable to UTI. The third thing we always want to look at too is your age. Because if you're older and you're in estrogen atrophy, then that would explain why you're getting so many UTIs. And we want to make sure then that in addition to treating the bacteria, we try to make your body stronger. And the way that we do that is by using some topical estrogen. When you give that skin estrogen, it thickens up, the mucosal layer gets stronger, and it will help prevent future recurring infections. To just treat those with antibiotics and not do the estrogen cream is a bit of a mistake because you're not understanding the concept of cause versus effect. So the UTI is the effect. What's the cause? The cause is that for some women, as you get older, your skin can't defend itself anymore. Your bladder can't defend itself anymore. And that's because of aging and the loss of estrogen, or if you've had a hysterectomy, or if you're in chemical menopause. We call that the genitourinary syndrome of menopause. And so you can keep chasing those infections with antibiotics, but until you improve the quality and health of your skin, you're still going to be vulnerable to UTI. Cindy said, can years of early menopause and low estrogen contribute to Hunner's ulcers, and are the two not really related? You know, boy, Cindy, God, that's a great question. Hunner's lesions are kind of the holy grail of the IC research movement, everybody wanting to find the absolute cause of Hunner's lesions. We have two clear theories, both supported by research. Theory number one with a Hunner's lesion is that it is of infectious origin, specifically a virus. The polyoma BK virus. It was researchers in Europe who first made that discovery 5 or 6 years ago. The National Institutes of Health has since confirmed that data. They too found that a small percentage of patients with IC actually have recurring viral infection in their bladder, 5 to 7%. I think if I remember that data correctly. So again, we would kind of ask ourselves, well, why are you more vulnerable to viral infection? And the answer might relate to some degree to your skin health. Although the polyoma virus is a virus that we all have anyway, it's part of the normal human biome. But gosh, we have to also understand the tremendous risk that HPV causes, human papillomavirus. I was just, God, what was I reading yesterday? It was just really, oh, yeah. So the human papillomavirus is a sexually transmitted viral condition that can cause urethral cancer. It can cause bladder cancer. It can cause vaginal cancer. It can cause rectal cancer. And it is also responsible for many of the throat cancers and the tongue cancers we see now. So, not to walk into debates about vaccines. The HPV vaccine is a pretty important vaccine because when you actually work with patients who have that, I was working with a young woman literally in her 30s, early 30s, like 32, 33. She had urethral cancer from HPV. They removed her urethra, they removed her bladder, and they did a whole total hysterectomy at the age of 32. And then they told her she could go back to work in 6 weeks. Like, are you effing kidding me? She's literally hollowed out. They've given her one of the worst procedures you can have. They've removed her bladder. They've given her a stoma. They've did a hysterectomy, and they told her she could work in 6 weeks. No, she's probably not going to be able to work for 6 months, maybe even longer. Recovering from surgery like that is tough. So anyway, HPV prevents a real threat there. And then the other theory about Hunner's lesions is that it is neuroinflammation, that it is a nerve that has become massively inflamed. And when nerves are inflamed, they release substances called substance P, which are quite damaging to tissue. Very damaging to tissue. So when we silence those nerves, the lesions often heal. So Holy Grail, and it's just going to be one of those things where there Hunner's lesions can be the result of a couple of different traumas to the tissues, the nerves, the blood vessels, muscles, whatever in the bladder wall. We just have stuff we've got to learn about that. Carla says, where can I order Tiger Balm or CBD cream? On our website, hon. Just go to icnetwork.org, icnetwork.org, click on shop, and just go right into our shop and look under pain relief. Shelly said, let's see. Excellent. Caroline says, have you got a link for the first generation DNA tests? Yes, it's bladderhealth.org, bladderhealth.org. So a next generation DNA urine test would allow you to look for any other interesting things that might be infecting your bladder. Good bacteria, bad bacteria, fungus, candida, and or potentially even viruses if you order the viral test. Marcia says, I have been horrible about eating sweets every day. I have to stop. I was walking around Walmart last night thinking about your love of cinnamon rolls. Walmart was out of everything except a $9 box of cinnamon. You couldn't afford that. I just have no, your bone density came back perfect. Excellent. Your resolution is to lose weight. Nice. You're working on your machine. Don't know if it's wise with the SI joint. Okay. Yeah. Talk to your doctor. So one of the things that I do now is I do these Xylamelts dry mouth tabs. Sorry, I'm on 2 different computers with 2 different cameras, so it's really hard for me to get it correct. There you go. Xylamelt dry mouth. So this is my kind of go-to now. Xylitol is innocuous in the sense that it doesn't irritate the bladder. See, it's just a little white capsule. A little white pill, and it has a kind of a brown background, and you can stick it on the inside of your lip, and it'll stay there for like 2 hours, just slowly releasing just a little bit of this mint, which triggers the formation of saliva. So if you have dry mouth, xylitol, these Xylamelts are really awesome. I don't really have dry mouth unless except for after I do these meetings, and maybe the next day I struggle with that a little bit. But here's the challenge with xylitol. The human body tolerates xylitol really well, but there's a line that if you cross it, it gives you diarrhea. So, that line is different for everybody. Some people might be able to handle 4 of these. Some people might be able to handle 12 of these before it might trigger a little bit of bowel distress. But this is completely IC friendly, and it happens to have a little bit of sodium bicarbonate and calcium carbonate in it. So that's kind of cool. Can be used with braces, dentures, mouth guards, or CPAP machines. Oh, by the way, so during our meeting last week, I was saying that, yeah, I'm going to have oral surgery. Supposed to have oral surgery last Monday. Canceled. They had COVID in the office. The staff were calling in with COVID. And since the infectious time is 4 days, so if they were calling in on Monday with COVID, they were COVID positive. That means they were working on Thursday or Friday. And so, yeah, canceled. Life. Amy says, does Jill do personal consults? I do. Yes, I do. My email address is icnetwork@mac.com, icnetwork@mac.com, or you can just call our phone, our 1-800-928-7496. Right at the top of the IC Network webpage is our contact information. I do coaching all the time. Every day I'm doing coaching now. You guys are keeping me so busy that I don't have the time to write like I need to, and the time to do our videos like I need to. I might limit coaching to 2 days a week so I can do all my publishing too. But anyway, right now it's a free for all, except for Mondays. Mondays I try to take off, although I start answering the phone about 2 o'clock on Mondays because that's when my staff leave. But you can just call our patient support line, and I usually answer that. So 1-800-928-7496. And if you just have a couple of questions, it's no worries. Hi, Jay. No worries at all. Happy to answer any questions I can. But if you want to spend a good long time talking about your case, 20, 30 minutes or an hour, I would have you sign up for a coaching session. Caroline says, can you get those shoes in England or on Amazon? You can absolutely get them on Amazon. And they're very, very true to size. I'm a size 9. Now that my feet are a little bit flatter, I'm a size 9. And their size 9s are perfect for me because there's a little bit of, I don't want my big toe to hit the end of the shoe. So my toe hits, the end of my toes like right there. Sorry for my dirty shoes, but you know what? That's life. Helen says, have a UTI every time you have a UTI every time you get in pain. And it's different bacteria every single time. Helen, how old are you, hon? I can't see how old you are by your name. Cindy, thank you so much for the 99 stars. You get all of the ones that I mentioned. So, you know, I have a family member who struggled with a lot of recurring UTIs and a lot of sinus infections. I mean, she just had lots and lots and lots of sinus infections. Sorry, my camera's moving a little bit. Hold on. And what we ended up discovering is that she had terrible infections just all the time, 3 or 4 times a year, if not more, bladder infections, sinus infections every single month. And we finally found out why. She has an immune disorder, and she's probably had that immune disorder for 20 years. So once they found that her IgG levels, immunoglobulin levels, were just rock bottom, once she started having IgG infusions, she's not getting infections anymore. So, Helen, I mean, I think it's reasonable to say, is there anything about my case or my body that would make me more prone to getting so many UTIs? I mean, it's either going to be estrogen atrophy, or it may be that you might be exposed to a lot of different bacteria for one reason or another. For example, if you work in the meat industry, boy, there's a lot of challenging drug-resistant infections in the meat industry. I would also be somewhat careful of and just upgrade the quality of the food that you're eating. As an example, we have a superbug E. coli bladder infection that was first found in China and a small farm a small community outside of a pork farm, and they call this a superbug because Very few antibiotics killed it. In fact, I don't think any antibiotics killed it. And they realized that it came from the pork farm, that the animals in the pork farm were so heavily treated with antibiotics. It created the perfect environment to grow this superbug. Then they found it in Germany and in Europe. I think they found it in the United Kingdom, and eventually they found it in the United States, again, like maybe 6 years ago. And it was a woman who, I think in the Philadelphia area, somewhere in there, who developed this completely challenging E. coli bladder infection that did not respond to therapy. And when they cultured it, it was this dreaded superbug. But the thing is she hadn't traveled at all. They were trying to figure out how she could have possibly been exposed to it. And she hadn't traveled at all. And so they started surveying some of the pork farms on the East Coast, and they found it. So understand that you can get bladder infections from food that you eat, especially meats. There was a case of a very rare, very difficult bladder infection that infected college students in Washington, Idaho, and Oregon. And they were able to trace that back to a slaughterhouse, I think in Idaho, that traced it then back to a specific ranch. So, there's this big perception that women are dirty, and we've all had those very insulting lectures about, are you wiping from front to back or back to front? Yes, sir. My mother taught me to wipe from front to back when I was young. I am now older. Believe me, I know how to wipe myself. Do not insult me by going there. But there's just kind of this whole industry that continues to perpetuate the thought that women are dirty and that our hygiene's poor, and it's just a load of crap. Bladder infections can come from food easily, and it usually comes from meat. So I would up my game with food, and I try not to eat any big national brands where I know they're breeding millions of pigs a year. I go for little local farms where I know that I can see the animals on the fields. I know that they're not being raised in a factory warehouse. In fact, I bought from my food delivery service, I decided to try a new breakfast sausage for my folks, and I unwrapped it this morning, and I did not like it, and it went down the garbage disposal. The proof is in the nose test. It smelled like old beef jerky. Ugh. Hi, Mary. Nice to see you, hon. Helen says, I've been in bed nearly 26 years with different infections. Oh, honey. Did they check your immune system? I mean, wow. And are you working with an infectious disease specialist? You really need to be working with an infectious disease specialist too. Caroline says the doctor won't give it to me, even though I'm only because of thrombosis in my family. Well, all I can do is tell you to get the research. You can Google it and give your doctor research that shows that the risk is not as prominent as they may think. Caroline says her daughter got the vaccine for HPV. Good. Cindy says her Hunner's lesions keep returning. They keep coming back. So Cindy, number one, the treatment options for Hunner's lesions are fairly limited. You're having one, fulguration. And what the fulguration does is it basically kills the nerve. You're just heating up or cauterizing the lesion, so you're sealing it. And basically it destroys whatever's immediately under that lesion, including a nerve. If they keep coming back, I think, given our research now with the viral connection, I think it'd be really interesting to maybe have them check you for viruses. The polyoma virus, we have that over on our website, and if you If you call me this week, I can actually maybe send you some links to some of the research that you can share with your doctors. Maybe that would explain why it's coming back. Now, Cindy, the other case that was so interesting was released. It was a case report released this year of a woman who had severe Hunner's lesions disease, and she had a severe prolapse. And they decided that they had to try to fix the prolapse. So when they went in to repair the prolapse, they found that her uterus had flipped front to back and back to front. And one of the ligaments that normally stabilize the uterus had broken. And so when they restored the uterus back to the proper position, her Hunner's lesions all went away, and she is considered a complete cure. And that helps us perhaps support the neuroinflammation theory that there was something about the way that she was, or the way that uterus was twisting that may have been compromising a nerve or triggering a nerve in some way. Amy says, oh, Caroline says, you do have a low immune system B12 deficiency. Well, there you go. There you go. So are you doing B12 shots? We do find a lot of B12 deficiency in women as they get older, including quite a few IC patients. And we do have a theory that is currently being researched that some patients with IC may have a variant of a condition called porphyria, which is a vitamin B12 processing disorder. That was research started by Barbara Flanagan years ago, 30 years ago. If you want to know what I'm drinking, this is a Frappuccino made with Dandy Blend herbal coffee. And I've actually put some frozen banana in there. It just shows that you can enjoy herbal coffee and that it's quite satisfying and wonderful. Amy says she has bubbles in her urine. It's kind of sweet smelling, no infection. Huh. Well, I mean, I think we all tend to have some bubbles in our urine when we urinate, but is it like soap bubbles? That's interesting. Let foamy urine is a sign of, okay. So foamy urine might be a sign of protein in your urine, which is not normal. Or, let's see. All right, hold on. Okay, so number one, you might have a super fast urine stream. Some amount of bubbles in urine is normal, and this can be affected by how fast the urinary stream is and how far it has to travel. Okay. Or that your kidneys aren't working like they should, and you're ending up with some proteins in your urine. Under normal circumstances, the kidney filters do not permit protein molecules from blood to pass through and end up in urine. An increase of protein in urine is generally evidence of a damaged or leaky kidney filter. Often, though, foamy urine is just one sign of a damaged kidney. Other signs include swelling due to fluid retention or weight gain. Okay, number three, if you're dehydrated, the more dehydrated someone is, the more concentrated their urine will be. As their body tries to conserve water. This results in foaminess because more substances are excreted in a smaller volume of water. Number four, you could have diabetes. Number five, you could have chronic infection. Number six, you're in the habit of taking pain meds. If you've even been taking over-the-counter painkillers for a while, your urine is looking foamier than usual. Those pills could be to blame. Liz said NSAIDs, particular Advil, Motrin, Aleve, can cause you to have high levels of protein. All right. Number 7, if you have an autoimmune disease. Number 8, if you have a type of blood cancer like multiple myeloma. So, don't be freaked out by that. I think number 1, are you hydrated? Are you hydrated? Okay, why is my hair being weird? You guys, I tell you every time, whenever I cut my hair, it grows back fast. Do you see how far it's grown since June? That's how far my hair has grown. It's a beast. Caroline, thank you for the 200 stars. So appreciated. I appreciate your support. Michaela said, you just had your hydrodistension to diagnose. You started bladder instills this last week. Anyone had good results with it, with some relief of frequency urgency? Michaela, bladder installations are step 2 treatment options. The American Urology Association has a 6-step treatment protocol for IC based upon the risk of adverse event. We don't want you to do the things that can quite harm you before you do the things that are quite easy. In fact, let me just get those real quick. Hold on. Let's just do this real quick. Now remember, now we're doing something called subtyping. We want to truly try to understand the anatomy, what's driving your symptoms. The AUA guidelines were created before we started doing subtyping. But let's just go through these real quick so that you have a really clear idea of how IC is treated. So the reason why we have guidelines is because doctors around the country did not have a standardized approach for treatment. That was the problem. Some patients were being told there were no treatments. Some patients were told only Elmeron was the treatment. Other patients were told that neuromodulation was their treatment. So what the American Urology Association did in 2010 was convene a panel of experts, kind of come up with a consensus-generated treatment protocol for IC. It was revised in 2014. It's really ideal for patients with IC subtype 1 or 2. Okay, but let's do this. So here we go. So this is the AUA 6-step treatment protocol. And you can read this for yourself at auanet.org. auanet.org. Go to the upper right-hand corner, click on the word guidelines, and then search for interstitial cystitis. Okay, so again, we have 6 clear steps of treatment, and they're arranged with respect to the risk of adverse event. We don't want you to do the dangerous stuff until you do the easy stuff. So step 1 is the easy stuff. Step 1 is the foundation of care. If you're not following step 1, the odds of other therapies working are going to be limited. So what is in step 1? Number 1, increasing your water intake. Your urine should be a pale, clear yellow. If it's dark yellow, the color of beer. If it's brown, you're dehydrated. We've got to get that water intake up. And the reality is that a lot of people don't drink enough water. You know who you are. Some people don't like drinking water. That's hard though, because your body needs water to eliminate potential toxins. Okay, so step 1, water. Step 2, modifying your diet. Because here's the other harsh reality is many of you develop bladder symptoms just because you have a rotten diet. If you're drinking a massive amount of coffee, you're drinking a massive amount of soda, and you happen to be a little bit older and you're in estrogen atrophy, then your symptoms could be triggered by what we call chemocystitis, chemicals. This is the same thing that happens with people going through chemotherapy. That the bladder, can be injured, and generally it's injured through some sort of chemical exposure. And so if you're drinking acid all day, every day, your bladder is not wired to handle that. It's not. Your bladder is wired to handle water. Your bladder is not wired to handle soda or coffee or green tea or energy drinks or coffee drinks all day. The third thing that the American Urology Association wants you to try are this over-the-counter supplements. Why? Because they have far less risk of adverse event than the typical oral medications or bladder installations. And the reality is that many of the supplements were created by IC researchers, such as Cystoprotect. And so those supplements, just so you know what they are, uh, all right, hold on a sec. So to give you just a clear idea of what the top supplements are, we're really looking for supplements that contain chondroitin, because chondroitin was found in one research study to be the most effective at restoring the superficial integrity of the bladder wall. So the supplements are going to be Bladder Builder, Bladder Rest, Cystoprotect. This is the longest, oldest supplement that's been on the market. It's created by Dr. Theoharides at Tufts University, big federally funded IC researcher. Cystomend. Some patients find aloe to be quite soothing, and so this is the aloe that we like. That's called Aloe Path, which is a combination of aloe with PEA to reduce pain. So there are a wide variety of supplements that are worth trying. Now, the other reality of the IC patient population is some of us are quite sensitive. I'm one of them. And so nobody can say this will help you. It's really trial and error. And the blessing that we have now is we have an abundance of things that you have the potential of trying, especially for those of you who don't have insurance or money is very, very limited. And you can't afford bladder installations and things like that. Okay, what else is in step one? Muscle relaxation. We started out this meeting talking about that. It's something I really struggle with. My muscles get very, very tight throughout the day and they start to hurt. And do I do anything about it? No. And I have to be more proactive than that. And then last but not least, maybe some acupuncture. Acupuncture certainly has been found to be helpful for some patients. I found, because I'm IC subtype 5 central sensitization, I found whole body acupuncture to be too aggressive. I didn't feel good with it, but localized acupuncture was not a bad thing. So this step one is really the foundation of care. It is the foundation of care. If you don't believe that the diet is important and you're drinking soda every day, the odds of these next treatments working for you are slim to none, because there's no treatment that can counteract the damage done by you drinking soda all day or coffee all day. Your bladder's injured. For many of you, you have clear bladder injury. Your job is to create an environment to support healing. So it's not about pouring acid on the wound every day, because if you pour acid on the wound every day, the wound is going to get bigger and the wound certainly would not heal. Your job is to create an environment that will allow those tissues to heal. All right, so let's go to step two. The step two interventions are going to be physical therapy. So, obviously at your very first appointment, they're supposed to check your pelvic floor muscles. If your pelvic floor muscles are tight, you are supposed to be referred to a pelvic floor physical therapist so we can figure out what the hell is going on with your muscles. Because long-term tight muscles cause ischemia. And ischemia is the equivalent of oxygen deprivation to those tissues and nutritional deprivation. When those muscles are tight, they squeeze blood vessels. And we got to get those, we got to restore blood supply. Physical therapy helps to restore blood supply. The second thing that we're going to look at for step two treatments are oral medications. That's going to be a bladder coating like Elmeron. But of course, we now know that Elmeron is linked to retinal disease, severe retinal disease. We have some patients who have gone blind using Elmeron. So Elmeron it has fallen out of favor dramatically. It's very, very hard to justify the use of Elmeron for a long period of time with this really good, clear data. They might also give you an antispasmodic, a smooth muscle antispasmodic like Dietary or Bacterial. If you are struggling with bladder spasms, and a bladder spasm occurs as the last couple of drops of urine come out of your urethra, if you get a very strong violent pain as that happens and it literally bends you over for 5 minutes and you can't walk, that's a sign that you're probably having bladder spasms. So Bacterial or Dietary can do that. They might suggest that you use a low dose antidepressant, not for depression, but because in very, very low doses, they help to stabilize and calm nerves that trigger pain. So this is where we have the amitriptyline, also known as Elavil, nortriptyline, imipramine. Okay, now again, the reason that these are in step 2 rather than in step 1 is because of side effects. And there are significant side effects to Detrol, ditropan, amitriptyline, and those like. They're called anticholinergics. And what the research shows is that if you take an anticholinergic every day for 3 years, you run the risk of dementia. So again, it helps us understand why supplements might be a more viable option, because the supplements do not have an anticholinergic effect, and they don't present with that risk. Now, the last thing in step 2 is pain care. The American Urology Association is very blunt, man. They understand that some patients with IC have very severe pain, and they want that pain treated. They do not want that patient suffering. So the AUA guidelines support the use of opiate medication. In certain circumstances, using an opiate medication can give that patient some quality of life while we're trying to figure out what the underlying problem is. But their approach to pain care is not just about opiate medication, it's about multimodal therapy. If your pain is coming from tight muscles, they don't just want to give you pain care, man, they want to fix the tight muscles. They're going to send you to physical therapy, and they might consider muscle relaxants and things like that for pelvic floor dysfunction. So you can't present yourself as somebody seeking pain meds. If you do that, you're going to be potentially labeled as somebody inappropriately using pain meds, right? So we have to have a multimodal approach to therapy. This is where another supplement has really opened a lot of doors. Peora, palmitoethanolamide. PEA has been used in Europe for decades for a wide variety of pain conditions. It is a simple fatty acid that has been found to be effective for patients with burning male syndrome, sciatica, fibromyalgia, acute pain, chronic pains, post-surgical pain. So in 2019, some European IC researchers did their first ICPEA research study, and they brought that to the American Urology Association meeting, and the data was nothing short of astonishing. The data showed that by month 3, 87% of patients using a combination of PEA and resveratrol had a significant reduction in their pain. That's 87%. And by month 6, a significant number were now completely pain-free. So, and the other cool thing about PEA is that it's remarkably well tolerated. There were no side effects reported in the ICPEA study. I went through about 30 studies. The vast majority of them showed that it was extremely well tolerated. There was only one study that showed side effects. I did just talk with a patient this week, though, who tried PEA. And what did she have? She thought she had a little reaction to it. She is allergic to eggs. There's no eggs in this, but she thought there were eggs in this. And we had to verify with the manufacturer that no, this is a synthetically manufactured molecule that does not come from eggs. So anyway, Peora, PEA, is something that you could potentially try. A lot of people ask me, what do I take? This is what I take, because I take it to keep my nerves calm. And it works really well for me, and I've never had a side effect from it. So, and the other cool thing about PEA is it happens to be like the cheapest supplement. It's like $24, $24.99 for a month's supply. So anyway, if you're struggling with pain, don't suffer in silence at home alone. You've got options. You're always going to be focusing on cause versus effect. The pain is the effect. You've got to work with your doctor to try to understand the underlying cause. Is it the bladder wall from Hunner's lesions? Is it the pelvic floor from some sort of injury? Is it something on your spinal cord, Tarlov cyst? Could you have a fibroid tumor pushing on your bladder? Could you have endometriosis on your bladder? Could you have pelvic congestion syndrome? There are a lot of other conditions that can trigger the bladder and trigger pain that need to be ruled out. If you're struggling with long-term chronic pain, you need to be the squeaky wheel. And again, you don't walk in and ask for pain. You walk in pain care. You walk in and say, can you please help me understand where this pain is coming from, because I want to fix it. Another thing I learned, I chaired our State of California Pain Conference several years ago that led to our governor signing the Pain Patients Bill of Rights here in the state of California. Yay, California. Oh God, I just lost my train of thought. Sorry about that. It'll come back to me in a minute. What was I going to say? Oh, well, it'll come back to me. Anyway, be proactive. Sorry about that. My brain races when I do these meetings. Let's go to step 3. What are our step 3 treatment options? Our step 3 treatment options are going to be a hydrodistension with cystoscopy and or Hunner's lesion treatment. Although the AUA guidelines are really crystal clear. As soon as they find the lesion, they want it treated. And so if they find a lesion, if they do a hydrodistension early on and you're not through step 2, they still want the lesion treated. And we treat lesions by fulguration, a triamcinolone injection, and I have to cross the Lyris off there. So those are the ways we normally treat lesions. Now let's talk a little bit about hydrodistension with cystoscopy. Hydrodistension with cystoscopy allows a doctor to look more closely at your bladder. Generally, what they do is they fill the bladder with some fluid, leave it in there for a period of time, drain it out, do it again, and this allows them to look very closely at the bladder wall. The AUA says it should always be done low pressure, short duration, not high pressure, long duration. And so high pressure is from 80 to 100. Low pressure, I think, is like 30 in the units they use to define pressure. Long duration is 5 minutes or longer. Short duration is 3 minutes. So the AUA now says short duration, low pressure to reduce damage to the bladder or minimize damage from the bladder. The reason why some patients feel better after a hydrodistension is because when you stretch the bladder, you break the nerves in the bladder wall. I mean, the worst thing you can do to a hollow organ is stretch it, right? That's why if you get a lot of gas on your stomach, it hurts really badly. If you stretch your bladder, obviously that also hurts really badly, and it temporarily breaks those nerves in the bladder wall. Unfortunately, the nerves grow back. And so you will have a false sense of success. If you're one of those patients where you have a hydro and a week after your hydro, all of your symptoms are gone, I mean, that's great, but you do have to understand that those nerves do grow back. That is why we call a hydrodistension a destructive therapy. San Francisco just scored? Yeah. 49ers all the way. All right, step 4. What are our step 4 treatment options? Our step 4 treatment options are going to be neuromodulation or Botox. So what is neuromodulation? Neuromodulation involves the use of a mild electronic stimulus on the nerves to try to restore some nerve function. It can be done, interstem is the method that is usually done at the sacrum in the lower part of the spinal cord. Unfortunately, the challenge with neuromodulation at the sacrum is that it requires a lot of surgery, sometimes multiple surgeries, and we have thousands of adverse events filed with the FDA over the use of surgical neuromodulation at the sacrum. Is it thousands? Well, it's many, 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 many hundreds. And I can show you where to find those. So most patients do not start with the surgical neuromodulation. They start with the ankle neuromodulation. That is called urgent PC rather than interstem. And basically what they do is they insert an acupuncture at a specific spot on the inside of your ankle, and they attach a TENS unit to it. And for about 20 minutes, they just gently kind of reprogram that nerve. I was an early patient myself. I was part of the research group that helped to get this FDA approved. And I think I can show you. We'll see how flexible I am. I don't know if you can see that little tiny black spot right there. That's my tattoo. That's where they stuck the needle. So it's 3 finger widths above the ankle bone, and it's about 1 finger width down from the ankle bone is where the needle goes. And then they have to put the needle in at a specific angle. So the reason why they gave us tattoos back then is so that we could do it at home. And I did it at home for a couple of years. The thing to remember with ankle stimulation is it should never, ever hurt. You have the option of turning the nerve stimulation up. If you turn it so high that it hurts, you're damaging your nerves. So we had a nurse up in Montana who called me years and years ago. She wanted to do it, and she was working with an acupuncturist to do it. And I said to her over and over and over again, it should never hurt. If you have it up so high that it's hurting, you're going to damage the nerves. And then somebody else she talked to told her the exact same thing. We reinforced this significantly with her over and over and over again. What did she do? She doubled it. And she ended up badly damaging the nerves in her feet. So the thing to remember about neuromodulation is it should never, ever, ever hurt. If it hurts, you're doing it wrong and you're damaging your body. The other option in step 4 is Botox, botulinum toxin. Here you go, right there, botulinum toxin. So Botox is a deactivated tuberculous bacteria that will silence nerves. And so the way that Botox is done in the bladder is they do a hydrodistension, and then they just they just give you shots in different parts of your bladder. But there is an issue here, because if they accidentally silence a nerve that controls your ability to pee, you're not going to be able to pee. So there are significant risks associated with Botox. Botox used to be a step 5 treatment. They dropped it down to a step 4 treatment when they realized that half of the dose was just as effective. So you're not supposed to do Botox if you're not able to self-catheterize, which is very tricky because they're giving it to a lot of elderly people who really cannot catheterize. But if I remember correctly, that was a big warning in either the FDA guidelines for it or whatever, or something the company said, that Botox should not be used in patients who are unable to catheterize. And now we get to step 5. Step 5 is cyclosporin. Step 5, cyclosporin is in step 5 for a reason. It has a lot of fairly significant, in some cases dangerous side effects, specifically very, very high blood pressure. As well, it makes you much, much, much more vulnerable to other infections. So, but on the other hand, some doctors really see cyclosporin as a bit of a miracle drug for some patients. Obviously, it works with the immune system. These are patients who are potentially, their immune system is overactive. It might be damaging their bladder. So if you put them on an immune suppressant, perhaps some of that damage will be improved, which kind of makes us think a little bit about the inflammation that happens in Hunner's lesions, although cyclosporin is not a treatment for Hunner's lesions. But anyway, it is an option. The other challenge with cyclosporin is that your urologist cannot do it. He will not do it. I don't know of a single urologist who does do cyclosporin therapy. They generally refer you to another doctor who specializes in it. Then last but not least, in step 6 of the AUA treatment guidelines for IC BPS is surgery. This is very, very rare. It is extremely rare that anybody would go in for surgery unless we're dealing with a lot of bladder damage or bladder shrinkage. So what they can do is they can attach a piece of intestine to your bladder to expand its capacity. Or as we announced early in December, Wake Forest University is doing bladder regeneration now, where they take they take some of your own cells and they grow a new bladder. They grow new bladder tissue with your own cells, and then they reimplant it and use that to expand your bladder capacity. So Wake Forest, Dr. Robert Evans has been looking for a few candidates who are willing to do this. They're moving up their FDA approval levels. So it's quite exciting. They've been doing this for years. They've been creating artificial, well, they're not artificial, they're natural bladders from your own tissue. For at least a decade, they've actually been implanted in children with spina bifida. The challenge here, the real challenge with bladder regeneration is blood supply. So generally what they do is that they take a piece of your bladder, a piece of tissue, 1 inch by 1 inch square, maybe even smaller, sometimes bigger, and then they separate out the different cell lines and grow them independently in a lab. And then they mount them on what we call a scaffold. And the scaffold is kind of in the shape of the bladder. And so they put the mucosal cells on the inside of the scaffold. They put the smooth muscle cells of the bladder on the outside of the scaffold. And so now we've got your own cells growing into kind of like a shape of the bladder. But the challenge here is that there's no blood supply. We've got to get blood supply to those tissues. So what they did for the children with spina bifida is, as they implanted these new bladders, they wrapped them in tissue from the inside of the abdominal wall that's very rich in blood supply. So they just kind of wrapped them, and eventually it worked. The treatment's no longer recommended by the American Urology Association. Long-term antibiotics, the use of BCG, Bacillus calix-guermin, a racinoferatoxin, of course, silver nitrate, chlorpactin, very old school treatments for IC that strip the bladder wall. We absolutely do not do those anymore. They're not even mentioned in the guidelines. They do not want high pressure hydrodissensions done anymore, or long-term steroids. So there you go. There are the 6 steps for the treatment of IC. But again, now that we're doing subtyping, it's changed a little bit. The AUA has not embraced a specific subtyping system other than bladder-centric and beyond bladder. And so you can expect that this is going to change fairly significantly in the coming couple of years. Jay says, are my Hokas the Bondi? Yes, absolutely. Bondi Hoka Ones are fabulous shoes. They're a little expensive, but you can get them. You can often get them on sale for half price at Zappos.com. I just got a pair. So, Michaela, getting back to your original question, which is, do patients have good relief with bladder installations? The answer is sure, but we don't want you to do something invasive until you try the easy stuff, which is improving your water intake, modifying your diet, maybe trying some supplements. That's not me. That's the AUA. Megan says, what effects could amitriptyline have on frequency? I was put on it to sleep. Since the doctor increased the dosage, I noticed my frequency has increased. Well, amitriptyline helps to calm nerves down, but some people can have a paradoxical reaction to meds where you have exactly the opposite effect of what the medication was originally intended to. So, I think ultimately in the end, you've got to talk to your doctor about that. You have more frequency, and it would be interesting to maybe stop the medication for a couple of days if your doctor approves that, to see if the frequency goes away. We'll see if we can establish a direct cause and effect with that. And if that's the case, then maybe what they can do is switch you to something like Mirabetrix or Mirabegron, which are the non-anticholinergic medications that have the same effects. Becky says, bubbles and a strange smell in my urine are a sign of an IC flare. Interesting. Tony said she had twice-a-week bladder installations for 4 weeks, along with twice-a-week pelvic floor therapy. Amazing result. If you had to pick the two, I'm going to bet that it was the pelvic floor therapy that was the most important. Rita, thank you so much for the 200 stars. Hello. Ann says, you cannot hear on Facebook. Well, other people can hear me, so it might be your settings. Caroline says, they stopped during COVID, so just gave me the pills, but I need the jab. But I need jabs as I can't absorb. Hi, Bet. Jesse says, what is a good pain reliever? Have done acupuncture, physical therapy, but it got too expensive. Well, again, Piora might be very interesting. This would be the next step because we got the research. Shauna says, I got the PEA bottle and tried it a few times, but it didn't work. Maybe I'm supposed to take it every day. Yes, it's not. It's not a traditional painkiller that acts at the spinal cord to block pain messages. What this does is it slowly but steadily helps to calm nerves down. That's the way palmitoethanolamide works. So you're not understanding how it works. It'd be interesting to give it a try for 30 days and let's see if that reduces your pain at all. Shannon says, Peora says to take it with a meal containing a healthy fat. I'm taking it with olive. How much olive oil should I take? Not much. Half a teaspoon. A couple of almonds would do just fine too. Ann says, does pyridium help frequency? It would only help. So you have to remember that urinary frequency urgency comes from the alpha afferent nerve in the bladder wall. So anything that helps to silence that nerve and calm that nerve down has the potential of reducing your frequency. And the pyridium is known for numbing nerves in the bladder. I personally never found it to be that helpful. Shanna says, I'm in a horrible flare right now. I made my own cashew milk, and I think it's that or maybe hormones. I just feel awful, so would love PEA, but like I said, it didn't work before as a one-off. Yeah, you can take it once or twice. I mean, it's 2 pills a day. You could do once in the morning, once in the evening. I take 2 in the evening myself. What would it be about cashew milk? I got to say, the last time I ate cashews, it gave me terrible, terrible GERD. What would it be about cashews that would, hold on. The problem with almond milk is that it's high in oxalates, and oxalates can really trigger the urethra, the vulva. So I wonder if cashew milk is high in oxalates. Let's see. Yes, it does. It does. Almond milk has the highest oxalate concentration, followed by cashew, hazelnut, and soy. So, hon, that's why you're flaring. Whoops, hold on a sec. It's got to be the oxalates in the cashew milk. Lisa over on YouTube says, what's the difference between hydroxyzine hydrochloride versus hydroxyzine pamoate? So hydroxyzine is an antihistamine that is recommended as a step 2 treatment option for IC. What it does is it basically stabilizes mast cells so that they're not triggering the release of histamine. It's an antihistamine. I took it for about 10 years. So one of the ways that we used to describe IC, and it doesn't really apply now because we have subtypes, but back in the old days, we used to describe IC as kind of like 100 mosquito bites at once in your bladder. Because if your bladder wall is damaged, urine gets into the damaged area, just like a mosquito would inject venom under your skin. So you've got something that's not supposed to be there now deeper in the skin. And what happens then is mast cells release histamine, and it's histamine that causes the swelling, the itchiness, all that sort of stuff. So using an antihistamine can help reduce part of that inflammatory discomfort pathway. The other advantage of hydroxyzine is it has a very mild anti-anxiety effect, and it can certainly help you sleep. It's a little bit harder to wake up in the morning, so you don't normally take it at bedtime. You normally take it at dinner time. So what's the difference between the two? Hydroxyzine hydrochloride is Atarax, and that's the most common generic. Hydroxyzine PAMOA is Vistral, and that is a more refined hydroxyzine. Hydroxyzine HCl is associated with a lot more side effects, whereas the PAMOA is generally much more well tolerated and purer. So I took one Atarax, and I knew immediately it would not work for me. It gave me a lot of weird side effects. I don't remember what they were. This was a long time ago. I just knew I took one pill and I felt awful. So my doctor switched me over to PAMOA, which is in a capsule rather than a pill, and that was gold. That worked just fine. So the other thing about hydroxyzine to be aware of is that it gives you something called hydroxyzine dreams. You will have more intense dreams while taking hydroxyzine. And these are, so if you're having a good sex dream, it becomes the best sex of your life dream. Like one of my dreams was one of my dreams on hydroxyzine was that I had sex with every actor in a Western movie. It was hysterical. And then the reason why I stopped it is at about a year 8 or 9 or however long I'd taken it, it started giving me nightmares. And they weren't just nightmares, they were night terrors, like literally watching my family be, killed in front of me. And I had one absolutely awful dream, and I knew immediately what it was. We stopped the medication. I haven't had one since. So hydroxyzine dreams are real. Might make you a little bit more heat intolerant also. So anyway, Elke says you're having a regular CT scan tomorrow. Should I ask them specifically to look at the iliac nerve vein area? You have to do IR2, possible PCS. Well, yeah, why not? I mean, listen, if you're having a CT scan, I absolutely, you want them to visualize the entire pelvis. Let's see if they find anything. Hi, Deborah. It's going to be very interesting to see what they find. It's specifically pelvic congestion syndrome too. Do you have good normal blood supply down there? I should have another one for my back. So with the CT scan, wait a second, which one is it? Which is it? Okay. No, I'm thinking MRI. So the CT scan should be a piece of cake. The MRI is a little bit more complicated, a little bit more stressful. That says milk put you in severe flares very bad. I bet the reason why regular milk put you into severe flares is might have triggered an overgrowth of candida from the milk sugar. Debbie says, do you do coconut milk? My IC is still irritated, but I'm not sure if coconut milk is affecting it. This is coconut milk. I mean, maybe you have a pre-sensitivity to coconut. You might. Shannon says, is regular milk okay? Sure. Just understand that, we're all fairly different. Borea said, I've had Hunner's lesions. They disappeared. Awesome. Yeah, they can. Rita says, is oat organic milk okay or coconut milk? Coconut milk's certainly fine. Oat should be fine too. If you're okay with oats. I'm not okay with oats, so I can't do oat milk, but I can do coconut milk forever. Knock on wood, my friends. Knock on wood. So on our meeting on Friday, I showed you guys some really interesting pictures of bacteria infecting the bladder from a researcher named Scott Holmgren. Now, YouTube, I can't show these to you. Facebook, I can. And so I want to do that again because I think that it's important that you see what happens. So give me a quick sec here. All right, so hold on one sec, Facebook. And YouTube, I will eventually get it to you guys too. I just can't do it right now because I don't have my streaming software running on YouTube right now. I just only have it running on Facebook. And so it's what allows me to share my screen and then stop sharing my screen. So hold on a sec. There you go. So you guys are now seeing my very messy desktop, right? Oh, my ear just started ringing. Oh, so annoying. All right. So for those of you on Facebook, and for those of you who are really, really interested in the concept of chronic UTI and E. coli, the preeminent expert in this is a gentleman named Scott Holmgren. And he has a lab at the Washington University in St. Louis at their School of Medicine. I have heard him speak twice, and honestly, if it weren't for COVID, if he were speaking in New York, I'd be very, very tempted to go hear him speak. He's amazing. And what he's done is he's taken a electron microscope right down to the bladder wall to show you live how bacteria infect the bladder, how it burrows into the skin, and what the bladder does to try to defend itself. So I want to show this to you. So this is a picture right here of E. coli. Oops. See, it's a slideshow. Let's go back here. So you notice E. coli are kind of long and skinny, and I want you to look at all these little these are called fibrins, little hairs that stick out of these E. coli's, and it's these little hairs that attach to receptors in the bladder to attach them there and eventually help them work into the bladder. We're going to skip this slide. Now, this picture is totally awesome because this is the urothelium. The urothelium, the top of the bladder, is the largest single cells in the human body. You see these big old cells right here? That's your bladder wall. That is your bladder wall. And here's your E. coli down here in the lower right-hand corner. Here's E. coli that's trying to get there. This big white thing, these big white things are coming out of the damaged hole. Those are neutrophils. These are your body's fighters. So they are emerging from this wound looking for the invader to kill the invader. Like, how cool is this picture? And you should see it in video. He has videos. He just doesn't have them on his website right now. So look, here are the neutrophils on your bladder searching for and trying to destroy the E. coli. And I want you to look at this. See all these E. coli right here along the intersections between these cells? You see how they're going for what we call these tight junctions? Dastardly little bacteria. Here are neutrophils eating, destroying. See this right here? Look at that. The neutrophil is opened up. Think of this as a mouth. It's sucking in that E. coli where it's going to kill it. We can skip these. Okay, look at this. So this also is an electron microscope. This shows the pillated bacteria, it has now gotten into the bladder, and now the bladder is going to wrap around it. Right, so the bladder is actually going to wrap around it right there, and now we've got an invader into the bladder wall. These, I think, are infected cells on the bladder wall that have swollen. I think that's what these are. Yeah, these are large intracellular bacterial communities. So these are now cells that have become bacteria factories. Now, this is important. This is what Scott Holmgren discovered that stunned everyone. You see these long, skinny noodles? That's E. coli. That when threatened with a something that could kill it, E. coli changes shape, and it goes from its normal circle to a noodle. And the neutrophils don't recognize the noodle as much, so it's harder to kill them. Now, I might have that slightly wrong, but he calls this a filamentous bacteria. I totally geek out with this stuff. What is this? This shows a nest of neutrophils trying to attack a bacteria. Interesting. And look, here you go. There's a bacteria right there in the bladder wall. Here it is again. That's an infected bladder wall. And look at this picture. This is very, very cool. This is a bacteria actually tunneling into the bladder wall. And these are fibers. Anyway, I wanted to give you a geek out and show you that. And if I can get more video, I have to look for it. I will try to do that. All right, let's go right back to my face here. Sorry, I'm sorry, YouTube. You guys will eventually see that too. And I'll try to do a video on that also. So how cool is that, right? Is that just like totally awesome? Amy says, I've been in a very bad flare, not feeling good now. My IBS is flaring up also. I'm sorry to hear that, Amy. What do you think triggered your flare? Do you think your flare is coming from you irritating your bladder wall? Or do you think it's coming from pelvic floor tension? Or do you think it's coming from stress? Because anytime you're under high levels of stress, your pain is going to be intensified. Guys, you have to remember that we have different types of flares. So if you eat or drink the wrong food and it irritates the hell out of your bladder, and it reminds me of the single worst bladder wall flare I've ever had. I was with my boyfriend at the time and some friends. We went to see a Harrison Ford movie. And I ordered a fountain drink 7-Up. It was a fountain made, and it was really, 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 really strong. And within 30 minutes of starting to drink that, I was in agony. And I kept running to the bathroom like every 15 minutes throughout this movie. And by the end of the movie, I was just hysterical. I didn't go with them. I drove myself home bawling my eyes out because I had bathed my bladder in a very, very strong acid. So if you're having that type of flare, rule number 1 is you got to dilute your urine, right? Get some water in there. Number 2, you can alkalinize your urine. You can alkalinize your urine with a little bit of pre-leaf. Or even a Tums, right? So pre-leaf is the oldest supplement out here. You take it if you're going to eat something that might be more acidic. So you can take this with coffee, you can take this with spaghetti sauce, you can take this with champagne, and it might help reduce some of the residual acids. Preleaf.com is a great website, and I actually write a lot of articles for them on food. That's really quite fun. I really enjoy doing that. So Preleaf would help you alkalinize your urine, or if you don't have Preleaf, you can just suck on a Tums or two. Or one of the old school approaches was a little bit of baking soda in a glass of water. Quarter teaspoon of baking soda in a glass of water would also alkalinize your urine and reduce some of that acid level. If that doesn't work, your next step is going to be something that will help to numb your bladder wall. Usually for over the counter, it's Azo Bladder Pain Relief Tablet, which is, ow, 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 see, right here, like right there. Oh, my SI joint is just so unhappy with me. Where is my Azo? It's not there, it's not there, it's not there, which means it's here. Where is my Azo? My Azo Bladder Pain Relief Tablets. It's here somewhere. Okay, well, anyway. Wait a second, is it over here? I tear my office up during doing these meetings, so it's somewhere. Anyway, so Azo is the over-the-counter version of pyridium. You can get it at supermarkets and drugstores. It's the stuff that turns your urine orange, and it might act to numb your bladder wall a little bit, a little. And at some point in time, you have to write it out. You're going to have to write it out. I mean, you know, you have the equivalent of a chemical injury to your bladder. Not going to go away overnight, but hopefully within a day or two, things will start to get better. But if they're not getting better, you know, you obviously you can call your doctor. You can get screened for a UTI just to be on the safe side, or they might even be able to do a rescue installation to numb your bladder wall, right? Generally, diet-induced flares are not long-term flares. They're like a 24 to 48-hour flare unless you screw up and you keep pouring acid on the wound. The patients who suffer the most by far are the patients who drink 1 cup of coffee a day, not understanding that that acid wash of that coffee is going to trigger a lot of long-term chronic pain. Okay. So that's just so that's one distinct thing if it's a bladder wall flare. If it's a pelvic floor flare, we're going to treat it very, very differently. So if, for example, you have a flare because you had sex, or you had a flare because you took a long car ride, a bladder wall with a pelvic floor flare, the flare is coming because your muscles have gotten tight. So now what we've got to do is try to relax those muscles. So your first thing to try is going to be using a heating pad. So if you have the classic symptoms we look for in a pelvic floor flare, which is kind of a lot of long-term burning, aching. You know, bladder wall flares are very sharp and shrill. Pelvic floor flares tend to be a little bit duller, steadier. That has a burning quality to it. If you can't start your urine stream right away, that helps us look at your muscle tension, because urination is about relaxation. If you can't relax to pee, then that tells me your muscles are tight. Or if you have sciatica or anything like that, that tells us that your muscles are tight. Okay, so heat. Using a heating pad for half an hour, sitting in a recliner, just resting those muscles a little bit. Then your next step is going to be trying a skeletal muscle relaxant, or getting out your wand and you working with your muscles. In fact, you would do that first. So the wand is, of course, it's over here on my desk. So if you, like me yesterday, it's so weird that sometimes it's the left side and other times it's the right side. Yesterday it was my right side that was tweaking me in the morning. And so as soon as I got up and I felt it, it's like, okay, I'm going to try to be proactive and work on it now. And so here's your pelvis. Here's your wand. And so what I did is I got in here through my vagina and I just worked on the muscle. I did and got the muscle to release, right? And so and when you get really good at this, you really learn what's normal and what's not normal. So yesterday my left side was fine, didn't hurt at all. My right side was as hard as a rock, especially down by my rectum, just the 2-inch piece, really, 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 really hard. And again, it took like 2 or 3 minutes of me just following the muscle that was painful, which happened to be right back here, right? This is where I was working. And then sometimes the physical therapist tells you to go across the grain of the muscle, or sometimes they just have you gently hold sustained pressure on the muscle, depending upon if you have a trigger point or not. So, you really can't figure this out on your own. You have to work with a physical therapist so that you know how to do it, and you know where you're working. But there comes a point in time when you get really, really skilled with this, and you can nip that pelvic floor flare in the bud and be independent. So you're not depending upon a pelvic floor physical therapist to help you. Skeletal muscle relaxants, vaginal Valium suppository, baclofen, Flexeril, Valium, right? And again, hopefully the muscles will eventually calm down in hopefully a short period of time. However, we always have to be receptive to the fact that for some patients, their muscles stay tight. Like for me, my muscles right now are staying tight because I have SI dysfunction. And so for those patients who have long-term chronic muscle tension, we want to step back from the muscles and look at the bones and try to understand what it is about the bones that are screwing the muscles up. So bad hip, bad SI joint, bad tailbone. If you have a tailbone healed out of position, normally your tailbone is straight and curled under, but if this is broken and bent to one side or the other, or instead of going under, it's going out, that is a common cause of IC-like symptoms and pelvic pain. So we want to always look at the bones, including the knees and especially the feet, because what Dr. Jerome Weiss found was that 95% of his patients who had long-term chronic pelvic floor tension were not walking correctly. We want to restore how you walk and get things normalized again. And one of the patients that I've worked with over the years, it's kind of a sad story because her muscles are as hard as a rock. They are locked down tight. And the reason why is because she was born with a club foot and she's never walked normally. And so now we know why her pelvic floor muscles are so messed up and triggering her bladder. It's because she just can't walk normally. And she will never walk normally unless perhaps they remove the foot and maybe give her an artificial limb. But, who wants to do that? That's awful. So anyway, Caroline says, Dr. Howard Schubiner cured me from IBS. Read his book. It's an eye-opener. You have no physical injury, believe me. I always love things like that. I like success stories. I have a zest to learn. What's the name of the book, hon? Let's see. I am absolutely willing to learn as much as I can. So, he's talking all about mind-body syndromes, also known as IC subtype 5. I like this. I like this very much. So IC subtype 5 are patients who have multiple pain conditions, IC, IBS, vulvodynia, et cetera, et cetera. And now, of course, we know that that's a central nervous system disorder that comes from a brain that is stuck in fight or flight. We call this a central nervous system maladaptation. It's not a mental illness. It's a brain that's been habituated to constant fight or flight, constant anxiety, usually from a history of either a very, very severe injury or a history of bullying or abuse. And so therapeutically for those patients who have chronic multiple conditions like the IC and IBS, we're going to be focusing almost entirely on mind-body medicine. We have to break that amygdala and the sympathetic nervous system off. We've got to turn them off. Pain that is accompanied by anxiety is intensified by the brain. Pain that is accompanied by laughter will minimize the brain. And the challenge here, and I think that Caroline would agree with this, is that for many, many years, when a doctor suggested mind-body medicine, we yelled at them. Don't tell me this is all in my head. This is not all in my head. I have a bladder injury. I'm up all night peeing. I've got IBS. I have diarrhea. Please don't tell me it's all in my head. That's how I felt 30 years ago. Well, in essence, it's not all in your head. It's all in your nervous system. That we have a dysfunctional nervous system that we've got to retrain. We have to retrain this nervous system. And we do that with mind-body medicine. Here, hold on a second. He says, what is mind-body syndrome, tension myositis syndrome? Here, hold on, let's look at this. I'm on the website, unlearnyourpain.com. He says, it hurts, your pain is awful. Hold on, sorry guys, my cameras are being all weird. There we go. You went to your doctor and he told you that you had a medical condition. The diagnosis was back or neck pain, presumably due to arthritis, a bulging disc, or spinal stenosis. Or the diagnosis was tension headaches or migraine headaches or fibromyalgia or whiplash or chronic tendinitis. Or it might have been stomach pain or pelvic pain with a diagnosis of IBS or IC. Your doctor prescribed drugs. You took them, but they didn't really help. Maybe you even had surgery, but that didn't help either. So if you decided to explore alternative medicine, maybe you took herbal remedies, vitamins, or you saw a chiropractor. You're considering acupuncture, hypnosis, or even crystals. But the pain is still there. You get the impression that your doctor really doesn't know how to help you or understand you. Maybe your doctor referred you to a psychiatrist or a psychologist, suggesting that the pain isn't real. But you're not imagining or making up the pain. The pain is in your body and it's real. But the problem is your diagnosis. If your diagnosis is wrong, you can't get better. You may not have a serious disease, but you do have a medical condition and you're not crazy. In fact, you're not much different from most people. Here's the real problem. Your body is producing pain because it's manifesting unresolved stress, possibly from your childhood or from stressful events in your adulthood or from your present circumstance. Your mind has twisted your body into pain as a way to avoid some of the emotions that are inside you. And if you haven't been helped by traditional or alternative medical care, the diagnosis may be mind-body syndrome. But you don't have to live the rest of your life with this pain. In fact, you begin to understand the syndrome and recognize what causes it. So I disagree with that a little bit. What the research is showing is that it's a central nervous system maladaptation. Listen, I love mind-body medicine. Anything that helps us with breaking out of anxiety is good. I'm sure his techniques are excellent. I'm a little bit, I don't like it when somebody says you have unresolved stress, or, there's kind of this implication that it's your fault. I'm not saying he's saying that. I just don't quite like the way he's wording that. What the research now shows us is that this is being driven by the amygdala. The amygdala is the fight or flight center in the brain, driven by the sympathetic nervous system. And what that research now shows is that the amygdala is not turning off. Normally, once the stressor has passed, the amygdala turns off, the parasympathetic nervous system takes over, and everything calms down. But if that amygdala stays on, you're stuck in high levels of anxiety, stress, and chronic tension. Because that's just your body. That's the most primitive part of your brain preparing you to fight for your life. I mean, there's no cognition happening here. It's just your body monitoring your senses, sensing a threat, and throwing you into fight or flight. The problem is it's not turning off. Unlearnyourpain.com. He has meditations. He has a blog. He has a letter. Has a new article. Oh, that's not new. Yeah, it doesn't have any new blogs past 2016. Well, anyway, let's see if there's anything else here. I just need more time to read all this. Imagine the movies they're going to be making in 10 years about how we got through COVID. Jay says, PRS helped me with central sensitization syndrome. Highly recommend. See, Jay, me too. It absolutely helped me with my own central sensitization. In fact, I just ran out. I ran out 2 days ago, although I don't feel it, which is good. Normally before Peora, I used to have a lot of skin sensitivity, pins and needles in my skin. It was really hard to fall asleep. And that's gone with Peora. I fall asleep just fine. It's great. I mean, all the prickles are gone. I might have 1 prickle or 2 prickles instead of 200 prickles trying to go to sleep. My skin is just so much calmer now. Caroline says he talks about the amygdala. Good. So wait a second. So here, hold on a sec. Did I miss? So where's the book on this site? Let me go to Amazon. Oh, and he has a workbook, Unlearn Your Pain, and the Unlearn Your Pain workbook. I love workbooks. A 28-day process to reprogram. Ooh, I like it. It's free in Kindle Unlimited. Unlearn Your Pain, the first 5 chapters. Wow, the original book from 2010 is selling for $632. Yeah, that's crazy. But here we go. Here's the paperback, Unlearn Your Pain, 3rd edition, $43. Or you can buy used for $25. I'll get it. Wow. Well, that's selling for a lot of money. Wait a second. Oh, it's out of print. That's why. Okay. I'll bite. Are you guys, let's see here. Okay. Nope, 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 nope. What? All right. All right. I'm going to get that book and review that book for you guys. Looks great. All right. What am I missing here? Mary says, how much do you take of Piura? What the bottle says is suggested use for 18 years and older. Take 2 capsules per day or as directed by your doctor or healthcare professional. Consume with a light meal that contains a small portion of healthy fat. Not formulated with wheat, gluten, soy milk, egg, fish, shellfish, or tree nuts. Preservative free. So you can get this on the IC Network website. Trudy says she's been taking marshmallow root for almost 2 months. It's helping. Awesome. Yeah, we have marshmallow root in our shop. We're working on a new flare tea right now. We're trying to create something very new and different for patients to drink if they're having a bladder wall flare, and there's going to be marshmallow root in that. So that's a viable option. I have to stop saying what I'm working on because I don't want somebody to steal it. I've done that several times. Jill, you have to shut up until it's available. Lisa asks, how did it help? Again, for me, it just calmed my nerves down. It'd be very interesting to see what Jay had to say. All right, my friends. Any more questions? We've been going for about 2 hours. Anybody want to go into Zoom? If anybody wants to go into Zoom with me and talk directly, we can do that too. Your choice. But if you're done, you're done, and I can go hang out with my family. So last call for questions. Last call for questions. Caroline says, wait, hold on a sec. Caroline says, I managed to retrain my nervous system and the power of the brain is unbelievable. Yeah, I have another book right here. The brain's way of healing, that I'm also in the process of reading. The little bit of time I get to do that. Last call. So you guys, if you find these meetings helpful, please think about coming on over to the IC Network, sign up for our free newsletter. Listen, I curate everything on the website. I never send out unreasonable or bad emails. I send out maybe an email once every 8 weeks, giving you the latest news on IC. So at a minimum, go sign up for our free newsletter. You can become a member and get our magazine, the IC Optimist. This is an example of the IC Optimist. We're working on our winter one right now. We've been doing this for 19 years. And you can consider getting our new book, IC 101. It's not just a bladder disease, which is where we talk about a lot of the brand new information. I spent Thursday and Friday filming a lot of new videos. Of course, I'm having some sound issues, so I might have to refilm them. But anyway, be prepared for a lot more new videos from the IC Network also. All right. Thank you, Vet. Thanks for signing up. Shannon, you have a question about oxalates. What's your question? Nancy says, the meds my new doctor wants me to try either gave me a bad side effect or way out of my budget. Yeah. Well, again, that's why, I mean, listen, when the only oral medication for IC, specifically Elmeron, can cost hundreds and hundreds and hundreds of dollars, and I shared the story on Friday that I had a lady call me who invested her entire life savings in Elmeron. She's a much, much older woman. She'd been on it for 20, 25 years. And I asked her, I said, did it help? And she said, no, never. And I said, why did you keep taking it? And she said, because there was nothing else around. And so she was somebody who literally, her entire life savings gone for a medication that provided no benefit. And again, now that we're doing subtyping, we probably know why. It probably wasn't her bladder in the first place. I bet for her, it was her pelvic floor or something else going on. So how do you know if oxalates are a problem with you? You're just going to have to track your food, hon. You got to look at foods that are high in oxalates, eat them, wait 24 hours and see if it irritates your bladder. The foods that are higher oxalates are going to be spinach. It's going to be chocolate, berries. Those are the foods that are really, really high in oxalates. So, track your diet. And one thing you can do, you guys, is we happen to have my gift to you last year was this awesome app that we created called Bladder Tracker. And it's free in the iPhone and the Android app shops. And this will allow you to track all of your symptoms as well as what you're eating, drinking, and the meds you're taking. So let's look at this for a moment. So the cool thing too is you never have to write the date down or the time down. The app automatically logs it. So we're just going to go track now and look at what we can track. We can track your overall wellness. How are you feeling? You can track your urination. So let's look at the urination here. Here you go. And you can rate it using a really simple color schedule. So pain before urination, let's just say for a bladder wall flare, that's going to be moderate. Pain after urination, none. Your stream, moderate. How long were you able to pee? 10, 15, 20 seconds. Did it wake you up from sleep? Yes. Okay, so I'm going to say that I was able to pee for 5 seconds. Right? Okay, and you can just log the entry, and now you're logged. And you can do this all day. What else can you track? You can track your stress level. That's important. You can track your pain levels. So let's do a pain level entry. You can track the location, bladder, pelvic floor. So let's see. I'll be on. I don't have any bladder pain. I'm having wicked left side pelvic floor. So that's what I'm going to do. Left side pelvic floor. And what does it feel like? It is, yesterday it was pins and needles. Today it's aching. I'm going to log my entry. You can track the medications that you're taking, supplements and or the medications, and the classic supplements are already listed in here. And so I took Piora 2, right, last night. I'm going to log my entry. You can track what you eat or drink. So what have I had this morning? I have had gluten-free waffles. I had 2 small ones. This is rare for me to eat before I do these. I also had 1 piece of sausage. Didn't like it very much, right? Anyway, there you go. You can log your hydration. How much are you drinking? So, I mean, this is all I've had to drink so far. I didn't even have I did have a little less water. I'm just going to call this 2 glasses of water. You can log your exercise. I did take a walk yesterday. I'm going to call it moderate, and it was for under an hour. But I also did I did a second round of muscle work. Okay, you can track your sleep quality. I slept great last night, 6 to 9 hours, although my jaw always is bad in the morning. I don't know what the hell I do at night, even with my mouth guard. You can log sex. That's going to be a big fat no. And you can make notes. You can make notes. So the really cool thing about this is that you can then do an analysis down at the bottom. You can do a single day analysis, or you can do a 30-day analysis. You can create a report, and you can email it to yourself and print it out and have it go into your medical records. Now, we may have to start charging for it. I mean, it cost about $25,000 to build. And let's just say that was a significant hit. In hindsight, would I have done it? No, I paid for about half of it, and then Natural Approach Nutrition paid. Oh, I paid for more than half of it, but Natural Approach Nutrition also paid for it. So that's a fairly big hit. So get it while you can, while it's free, because I might start charging 99 cents for it. I might. Nancy says, this is so helpful. I did join the network. You are a wealth of info. Okay. Okay. Shannon says, there are many foods on the oxalate food list that are okay on the. I know, hon. This is trial and error, hon. It's not like there's one master list. Nancy says, I didn't really want to take Elmeron anyway because of the eye issues others have had. So said I would try, but it would be $800 for a 90-day supply. The pelvic therapy is helping me get out of this flare. Exactly. I mean, listen, we learned 20 years ago. I mean, when I started being a support group leader 28 years ago, well, no, Elmeron was approved in 96. So that was like 22 years ago. You know, we knew that many patients who took Elmeron had no success with it. And the question is why? And the answer goes right back to, does that patient have a bladder wall issue? Now we know that many of us do not. Many of us do not have a bladder issue. Shannon, have you tried support groups other than Jill's? Yeah. You know, the challenge with support groups is that, I mean, I started the very first support groups online. I built the very first website online. I've got 50,000 people in well, more than 50,000, probably 150,000 in our web-based support group. And I had trained staff running it. It's very quiet now. Websites are kind of the dinosaurs when it comes to the internet now. We have a massive amount of information over on the IC Network website, though. I don't know. I mean, it's just challenging because with our support group, I trained everybody. And there are some support groups on Facebook that are just not trained well. There's one support group kicked out all men because it said men didn't get IC, which is completely wrong. So you got to be careful. I don't, honey, I haven't clicked your link. I don't know what group you're referring to. So. Caroline, would you be willing to write up your story? Because I would love to tell your story. I would love to tell it in our magazine, and I would love to be able to share it on our website. If you would be willing to write up your story and be pretty specific about it. What were your original symptoms? How you found the book? How the book helped you? What were the essential tips in the book that were the most meaningful for you? And how you're doing today? I would love to tell your story, hon. I would love to. Oh, IC Wellness. Yeah, IC Wellness rocks. Oh, okay. Well, wait a second. I'm sorry. I get groups confused. I am not familiar with IC Wellness. I take that back. I was thinking of IC Warriors, and then I was thinking of what I was really thinking of was the IC 101 group on Facebook. Glad you're downloading the app. Carolyn, great. My email address is icnetwork@mac.com. Would you please email me and put the subject all in capital letters? And if you don't get a response back from me in a couple days, email me again or call me. I'm getting hundreds of emails right now. So sometimes I lose it. Mary's asking about avocados. They're fine. They shouldn't bother anybody unless you're allergic to them. Judy says, I need to take something for gut motility. Does ginger hurt the bladder? No, ginger is usually pretty good for the bladder. That's why some of us can drink gingerbread teas without issues. Are you talking about fiber? Do you need fiber? So Heather's tummy fiber is specifically created for people with IBS who have more sensitivity. So love this stuff. This is what I use myself. I do a teaspoon a day. So you can find this over on the IC Network store under fiber and laxatives. All right, my friends. Well, listen, I wish you well. Y'all have a wonderful rest of the day. Martin Luther King Day tomorrow. It's a very important holiday for us. Martin Luther King absolutely is an inspiration for working together. And so I think it's very important to ponder on holidays like this, the reason why we have this holiday. He would have just turned 93 years old. And if you can, take a minute, and if you've never heard of Martin Luther King or you're not familiar, go to YouTube, search there, and listen to his I Have a Dream speech. It's incredible. Absolutely incredible. What a gift he was and continues to be. So, all right, my friends, I will see you later. Have a good one. I'll hopefully see you on Thursday here on Facebook. And anyway, there you go. Have a good one. And please remember, I don't give medical advice. My job here is to open doors. I try to educate you, empower you, give you new questions to ask your doctors. But ultimately, in the end, the goal here is to kick you in the you-know-what and get you back to your doctor with new questions. So, all right, guys, I'll see you later. You're welcome, Nancy. Thank you. All right, Facebook, you're done. All right, YouTube. See, now I can put this camera over here on this computer, right? Where you belong. See, now I'm looking at you. Let me just see. I want to see if it will let me share my screen so that I can show you those amazing pictures. I don't know if it will let me do this. It probably won't, but hold on. You know what I can do for anybody here is I can shut down the stream and start it up again. Oh no, that would be hard. God, I would really love for you to see these pictures. They're out. You know what I should do is just print them out. Maybe I'll do that. All right, you guys. Well, listen, y'all have a wonderful, wonderful rest of your Sunday. Enjoy your holiday tomorrow, but let's take this holiday with the spirit for which is meant to be. Be well.